vibrant well-being. In a world full of noisy health trends, we bring you clarity. We reveal the science-backed strategies that truly work in a sea of fads. We explore the physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who've conquered life's health challenges. Are you ready to unlock your potential to live with vitality and purpose? Then join the health revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game, starting now. The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Health Revolution, and we're excited that you are joining us today. I'm your host, Adriana Morrison. No matter which way you're tuning into us, please don't forget to hit the subscribe button. We want to stay connected to you. Also, at the bottom of your screen, there is a tab for show episode notes. You're going to want to be aware of that. There's some important information that we can reference for today, so take note. Today we're talking about a topic that we really need to get a better understanding of, and it is managing healthcare chaos. Of course, we know as we're managing through life, and ever since these last couple of years, it feels like a tug of war sometimes with the medical space and us being patient and maybe our doctors or providers, and sometimes it just can leave us frustrating to say the least. And in this navigation that we are trying to do, how do we utilize the tools and what do we need to learn to set ourselves up for best practices so we are set up for success? My guest today is someone who is well versed in this. I'm excited about the receipts she is bringing to the table. First, take a look at this. Meet Lidia Molinara, a TEDx and United Nations speaker dedicated to empowering patients to navigate the complexities of today's healthcare system. With over 30 years of experience as a clinical pharmacist, certified geriatric practitioner, and patient safety officer, Lidia has seen firsthand how challenging it can be for individuals to advocate for their own health in a chaotic system. Her mission is to provide patients with the knowledge and tools they need to avoid medical and medication-related errors, ensuring they receive safe and effective care. Today, we'll uncover her powerful insights into simplifying the healthcare experience and empowering us all to take control of our health like never before. Lidia Molinara, welcome to the show. How are you?
Really great. I'm genuinely grateful to be able to have this opportunity to share some of these insights to really help empower people.
You know, I'm excited because you represent the space of doing all you can to understand some of the challenges we have trying to navigate through the healthcare system just as a patient. And then perhaps we have loved ones who are dealing with this. So I'm curious, what got you into this space and what made you want to grow your voice and to do further good to bridge the gap?
Well, being a pharmacist behind the counter, I've seen and heard so many stories and people just genuinely frustrated, having no ability to really understand how to navigate the system. The system, unfortunately, it doesn't matter where in the world, has become complicated and a bit chaotic with shortages of staff. And there's a whole host of reasons for it. But it leaves the person who is sick or has an ailment trying to navigate this real big complex world with knowledge that is not necessarily at our fingertips, with language that seems like it's a foreign one because we talk in medical terms. And as a healthcare professional, I felt it really important for people to avoid medication mishaps and to really navigate it safely, because there's also errors that happen in healthcare, that it's really important to give people the tools to understand how to do that. And I I did do a lot of work in behind the scenes in teaching, being a patient safety officer. And I realized that this is not common knowledge. It's not common practice. We don't teach this. We don't know where to find this information. And it's almost like you have to experience it and go through it to then learn from your experiences. But by that time, sometimes it's too much hardship that you've had to go through. And as caregivers, as moms, as caregivers to older parents, or even just a neighbor or an aunt, sometimes we are faced with being advocates and trying to help navigate for people we love. And it's hard to do that when we see someone who's suffering that we love. We want to be able to do our best to help them. And that's really what I'm trying to accomplish in providing these tools.
Always been this way, that this concern, this level of concern that we have today, that we feel today, has it always been this area where we just need to understand more? Or was there a point in time in which so much was happening that patient safety became more in the forefront?
Well, we have to consider that, even in my career span, 30 years ago, there wasn't as many drugs on the shelf. There wasn't as many technology operations, solutions to things. There wasn't as many diagnoses of diseases. So everything has just literally become more complicated as time has gone on. At the same time, you look at funding and corporations and how the whole healthcare industry has evolved, and what it means with insurance companies and different layers of corporations that impact our health. And that's where the complexity comes in. Healthcare professionals take even longer now than it used to before to learn everything, and it's almost impossible to know everything. So it's really, really changed in the sense of, as a consumer, before you had an ailment, there was only so many things that we could select as a treatment, and you made a decision based on the fact that your doctor knew the most, and he did. But remember, we now have the internet, and we have resources, and we have ability to look things up and to understand more and to track our symptoms and to go with this information. So it really has shifted. The complexity is there, but the opportunity as well for us as consumers to understand and learn more so that we can become better advocates for ourselves, for our loved ones, is now. And I really truly believe that it's so important to do this because it helps prevent errors, and those errors that are preventable come back to the fact that as a consumer, if you're actually actively engaged, reduce. And we know this. Even the World Health Organization has a World's Patient Safety Day. And the reason for this is because we recognize the amount of errors that happen in healthcare. So, in other words, you're seeking healthcare and you have an issue and an error that happens to you that can debilitate you even worse. So, preventing that now is another tool that we need to know in order to navigate the healthcare system safely.
What is your role, or let me back up. How describe your relationship that you have with doctors and with insurance companies? How would you describe the relationship you have with both groups?
Well, with physicians, pharmacists and physicians work quite closely together. When I owned and operated a specialty pharmacy, we created something called Doctor's Rounds. So we would physically go with the doctor to see patients in their homes and in the assisted living facilities or supportive living or long-term care sites. So physicians and pharmacists work quite closely together. The physician is the diagnoser. So he's the one who can do all the touch, feel, and diagnose based on the disease state. He's the one that kind of, or she, I should say, the diagnoser is the physician. And then based on that, typically what will happen is there's a subset of things that they need to rule out or they need to figure out. So they're going to send for labs and tests, and they're going to analyze all that and make a decision on what they feel is the diagnosis or the symptom or the cause of what's happening. And the pharmacist then takes the next approach in, okay, well, if it's going to be a medication as the drug therapy, what medication is best suited? What dose? What are we looking at as far as the patient overall? What are their other disease states? What are their capabilities as far as in their body, their organs, with their kidney function, their liver function, their lung function? We kind of have to look at all that. What other medications are they taking? What other things do we need to worry about as far as, if someone is older and they have, dementia, well, then which medication is going to cause a problem for that? If they're older, which medication can cause more falls? So we look at the whole picture of the patient and we match the medication to the patient to make sure, number one, it's treating what we're trying to treat. Number two, we're managing the side effects of that medication. And we're also educating the patient so that they know the best way to take this medication and what I like to call following the rules of the medication so that they stay safe when they're taking it, and know when, if something isn't right, know when to seek medical attention and where you should be seeking that medical attention. Is it the hospital? Is it the emergency? Is it just a phone call to the pharmacy? Is it to go back to see the doctor? We help to navigate that for patients as well.
I had no idea until this conversation now what the workload is and the management of all whom you serve. And can you quantify what the range is on an average year, or like month to month? Like what all what does your management look like when you're overseeing the care of patients?
Well, this is where it depends sort of on the corporation or the pharmacy that you work at or the hospital that you're working at, what the capacity levels are. There is no question that today versus when I started 30 years ago, there's a shortage of healthcare providers. So our capacity is overwhelming. There's a lot that we have to do. And this is not just for pharmacists, this is for every healthcare professional. Hence the reason why I say you really have to be actively involved, because there's just an overwhelming amount of people versus healthcare professionals. That ratio is not balanced as it should be in order to provide effective care, in my opinion. So, what we're doing is looking at a pharmacist workload. You know, Pharmacists are able to manage typically on a day. We have a pharmacist filling 100 prescriptions a day. So what does that mean as far as interactions are concerned? Well, those 100 prescriptions doesn't always mean a brand new prescription. Sometimes it's just a refill. It's just an over the counter medication that's picked up, a Tums or something simple. It's not complicated, but it ranges. We're there basically, in some pharmacies from 7 a.m. to 11 p.m., sometimes midnight, sometimes 24 hours. And the workload is heavy. It's not simple. Phones ringing. It's like, everything's binging and going off. I think of it like fireworks when you go on to a shift. But it's really important that your pharmacist, when you are seeking one, does have the time to speak to you. And you'll understand when you're going in to speak to a pharmacist or when you're going to get your prescription filled. If you don't have access to the pharmacist, then that means that that operation isn't running in a way where patient care is number one. And when I ran my pharmacies, I always made sure that the pharmacists had a workload that was manageable so that, number one, clients stayed safe. Number two, the pharmacist didn't feel overwhelmed so that they were making mistakes and then felt terrible about the fact that they were making mistakes. And number three, that we had good customer service. And customer service for me as a healthcare professional means that the customers appreciate our work as healthcare professionals, not our work as, this is a pill, blah, 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 away you go. It was more of, we developed a relationship with our clients and they felt that they were being seen and heard. And that is the most important thing as a healthcare professional that we can provide patients.
I appreciate your input with this, because I don't think the general public, no matter where we live, has an in-depth understanding of what you all do. So I'm learning right here as you're sharing and just disclosing some of the behind the scenes. And what are some things that you wish the public knew about the of what the intentionality behind what you do?
I think it's really important when you look at what I call sort of the healthcare complication and complexity is that you have to understand that healthcare is not easy either for healthcare professionals. We work in strenuous situations. We work in environments where sometimes the technology is not working as it should. We work in situations where, we're running on steam. Literally, we're just going and going and going, and it's kind of like when you drive home and you don't even know how you got there. Sometimes shifts feel that way because you're so busy, you can't necessarily pay attention to all the detail, you have time constraints, and you're almost on autopilot. The other thing that's tied into behind the scenes is there is no restriction on your shifts and sleep necessarily. So you'll have physicians, you'll have residents, you'll have pharmacists that do overnight shifts. Sometimes they're crazy for residents and physicians that they'll do 24-hour stretches at a time. Now imagine we have all this information about sleep, and yet we don't restrict that from happening in healthcare, where the healthcare professional is mandated to have so many days off or is mandated to not work 16 hours a day. But because of the shortages, we're almost forced to be there. Otherwise, there's no one doing the care. So I think if you understand these complexities that can happen behind the scenes, you'll be a lot more alerted to, oh, maybe the reason why somebody didn't double check that I had an allergy to penicillin is because they've worked 16 hours. Or maybe it's because there's 12 other people waiting for them to be seen and there's not enough time to check all the details. So, as a client, as a patient, it's really important for you to make sure that you're advocating and saying, oh, by the way, I have an allergy to penicillin. Does the medication contain any penicillin? Oh, by the way, I'm allergic to latex. Does the band aid have any latex? Those little things really impact your care. And it's important to say them because it's not an excuse that we shouldn't, or a lack of responsibility that we shouldn't be doing those things. I know we should as healthcare professionals, but it's under an environment that doesn't necessarily allow us to do everything that we should do from A to Z properly and safely, so that those things are alerted to us. And that's the system. And so, as a patient safety officer, I think the best way to describe this is I was in the course when I became a certified patient safety officer, and the instructor went up to the front and she had three bins: a red, a yellow, and a green bin. And she said, okay, I want you to take this. And it was kind of like a bucket. And she said, I want you to take it and I want you to make sure that you don't pick up any yellow pieces, but you've got to put it in the red bin, the green bin, and the yellow bin. That's the system. You have to put it in that bin, but don't pick up any yellow pieces. Impossible, right? It's impossible. I mean, if the system is making you go through these things and you're under that pressure, it's impossible for you a lot of times not to make an error. And that is, the reality of behind the scenes. And you put that as well, another thing which is completely unpreventable, which is human error. So as good as you follow and as perfect a system as there is, you still are likely to make a human error. No matter how brilliant, no matter how well versed you are on the policies, these things can still happen. So as a consumer, you need to be aware and you need to be advocating for yourself to prevent problems.
One quick question before we go to our first break. What areas are you able to raise a red flag on something, if whether there is a contraindicator of any sort, or what are some areas in which you're able to use your voice to say, oh no, wait a minute, we have a situation here, whether it's a communication with the doctor or you see something coming up, you see a situation looming. Where can you pull that card and say, hang on, everybody?
Absolutely, at every point of your healthcare journey. It's so important you do it. There's no point. It's just the whole thing. Because when you're going in, your subset of skills, we talk about advocacy, there's also communication and education. Those are the three key principles, the ACE principles. But at every point, you need to be using those principles so that when you are navigating it when you're going in to speak to a doctor, speak to a pharmacist, speak to the ER nurse, go into the ambulance, speak to the ambulance driver, any point, those three principles are there. You need to make sure that if someone is saying, we are going to give you a medication, that if you have an allergy, you say, I have an allergy to this. We are going to give you this medication. Oh, I don't do well in this regard, or I get very nauseated, so that they know, oh, okay, well, if we're going to give morphine and she's going to get nauseated, she's going to likely throw up. So let's make sure we add some gravel in there or another medication, whatever that is, to make sure that they don't get nauseated when we give this. So your experiences and your, ability to relay those experiences are invaluable. We don't know everything about you, and we can't remember everything about you, even if we're reading your chart. So it's really important for you to make sure that you advocate at all points.
And we're going to dive into these points in detail. First, we're going to take a commercial break. Stay right there. Don't go anywhere. We will be right back after this.
So NAD is something that we use for people who are going through withdrawal symptoms, whether it's opioids, whether it's alcohol. GABA receptors in our brain is something that alcohol affects when we drink. So when you're going through alcohol withdrawals and I give you the Calm bag or give you Calm with GABA in it, it kind of gives your brain that kind of fix, so to speak, of the alcohol to help with the withdrawal symptoms. I'm not saying it gets rid of them. I'm not saying I give you GABA and you're good to go forever. That's not what I'm saying. It's, again, just like everything we offer, it's a relief.
Introducing Launchpad, the perfect partner to help you launch your dream project to the world. We know that time is of the essence, and we're here to help you make the most of it. With Launchpad, you'll get access to the most advanced digital tools and strategies to take your idea from a mere concept to a fully fledged success. Whether you're an aspiring entrepreneur or a seasoned pro, we have everything you need to make your mark in the world. Launchpad, your ultimate launch partner.
Welcome back to the Health Revolution. Today, we're talking about navigating healthcare chaos. Our guest today, Lidia Molinara, she is a patient safety officer, a pharmacist, TEDx speaker, and a podcaster. And we are doing a deep dive in what our path looks like and how we can better ourselves so that we can better manage our own health. And Lidia, before the break, you started to talk about the acronym, the ACE, about advocating, the communication, and the educating. And I want to dive into that. First, I'm just curious, what are some of the common mistakes that we make that when we are navigating through, just in society's habits, when we are navigating through the healthcare system?
Well, the first mistake is we feel that everything is safe and that everyone's got all the knowledge in the world and we don't need to be an active participant. Number one mistake. Can't do that. I think that's where a lot of people then become very upset and sort of disillusioned with what the whole healthcare system is all about. So I think it's really important. Active participation is number one. I think the other thing is we sometimes feel that we're not necessarily having to follow the rules when it comes to medications. It's okay. Instead of taking one, I'll take two, or instead of 12 hours apart, it's okay. I don't have time, so I'll just take them 2 hours apart. These things are chemicals and they can cause harm. So there are rules to them that need to be followed to keep you safe. The other misconception, or I guess the other problem that we see, is people feel that, oh, well, if it's a herbal product, it's because it's from a plant, it's safer. It's okay. I can take it with all my other medications, or I don't have to take my medications. I can just take it with that, or I can just use that. Sometimes disease states, are progressed enough that herbal products are not the key to, therapy. It sometimes is for prevention, but not after the fact when you have an issue. And I think sometimes we, like you say, there's so much noise out there that we feel that, oh, if this worked for this person, it might work for me. You really have to make sure that you're looking at the whole situation. And one of the other key things that I think we make a mistake on is we don't assess the risk versus the benefit of a treatment. And we need to do that more. We need to understand, well, what is the benefit of taking a herbal product that I want to consume, even though I don't know a lot of information about it? What's the benefit of it versus not taking it? What is the benefit of this operation versus not having the operation? What are the alternatives? We need to ask more of those questions. And I think assuming that everyone around us knows the answer, nobody knows the answer for you better than you. You know your body more than anyone. And that's the importance of advocating for yourself.
You bring up a point about not taking medications as directed. How often have you seen that in your profession? Because for someone like me, I always think that it is, that I don't want the risk that if there is some sort of contraindicator going on or side effect that it could, I could only imagine. But how often do you see that, or how often does this come up?
Well, we look at statistics. And so, of course, that we know, number one, about 50% of medications are not even taken the right way. So that's called medication adherence. So, in other words, if it's supposed to be taken once a day, sometimes we know we don't take it once a day. We might take it 5 times a week instead. So we know that exists. We also know that the number one reason that we are put on medications is to treat an ailment or a disease or a chronic condition. And we understand that if we don't take it as appropriate, we end up in hospital because now these sort of solution to some of the problems or the symptoms, they don't get addressed. And so then you're now in the hospital because your high blood pressure has rebounded because you stopped a high blood pressure medication, and now it's like a bouncing ball. Now your blood pressure is even higher, and so you're in the hospital because your blood pressure is 180 over 100, like it's too high. So we see this a lot as pharmacists. When a patient comes in, they'll say to us, I haven't taken that medication, or they'll stop an antibiotic 3 days too early, and then they get sick, and now we have to give them stronger antibiotics, and now it's not working as well, so they end up in hospital to get an IV antibiotic. So yes, this is why, as I keep saying, it's so important to follow the rules, because I see so much that it's really motivated me as a pharmacist. The first question I ask when people come in to pick up their refills is, how has it been going? Have you been taking it as prescribed? Did you alter it in any way? Was there any other things that you find that this medication doesn't work for you? Is there problems when you take the medication? I start with that rather than which medications do you need to have refilled, because being truthful is also really important. And I think sometimes we feel like, oh, I didn't follow the rules, so I shouldn't say anything. But in fact, it's the opposite. If you say that you haven't taken something as directed, it gives us a better perspective on what's going on. So if you go to your doctor and you say, I didn't take that second high blood pressure medication, that makes a big difference, because now the physician isn't upping the dose or changing the medication altogether. It's more so, no, I have really bad swelling in my legs and I didn't want to take it anymore. Okay, that's perfect. Let's now move on to how we can resolve this issue, rather than, oh, well, I'm assuming you're taking the medication. That's a different scenario. So it's really important to be truthful as well.
You brought up the situation of blood pressure, and I'm sure that there's a multitude of scenarios in which we should not do that, not not take it as directed. But can you name examples of others that maybe we don't realize the gravity of not following through? Other conditions or any ailment related diagnosis that we should never mess with and that we should follow it to the T?
Well, the medications that end up making people go to the hospital, antibiotics is probably right up there with high blood pressure medications, heart medications. Antibiotics, when you stop it early, does not, when you feel better in a few days, you stop it early, it does not kill all the bacteria. Antibiotics have an, an, an ability to fix what the bacteria is growing, but it also kills your normal bacteria. So then you have sometimes diarrhea. And if you take antibiotics over and over and over again, you can have a condition where you end up really causing harm to the intestine and you end up in hospital. So it's C. diff. And so there's antibiotics probably is number one. So really making sure that if you are taking an antibiotic, you understand with or without food, with other medications, with a probiotic, what should you do to eliminate the side effects and also to make sure that you're taking it till it's completed. So, nausea is sometimes the reason why people will stop. So what should you do? Well, eat something with it, but it should be on an empty stomach. It's okay. Even though it's supposed to be on an empty stomach, have the conversation so that I can take this with a few crackers, not affect the absorption, so it still gets into my body and I'm still taking it. Or it just might simply be, we need to stop that medication and start something else. So antibiotics is a big one. High blood pressure medication is also a really big one because a lot of people don't want to start taking high blood pressure medication. It's a lifetime medication that you take. High blood pressure can be caused by genetics. So, if there's a family history of it, that can happen. When people don't take their high blood pressure medication, it can lead to kidney disease. And I mean, Tina Turner is an advocate about renal failure because that's what she did. She didn't take her high blood pressure medication for years, and then it later turned into a renal disease. So it's really important that you understand why you should be taking your high blood pressure medication. And if you have objections to it, have the conversations. No, just don't just say, no, I don't want to do it. Why? What's coming up for you that you don't want to do it? Is it because it's causing you to have a headache? Is it because you're struggling with taking it every day? What are some tools that you can put in place for that? So high blood pressure medication is really important. Antibiotics. And then there's also medications like stomach acid reflux medications that people are on for years and years and years, and they shouldn't be. It's sort of like been left on it, and then we're talking about PPI, they reduce acid in our stomach, and we see people come into hospital because they've been on this medication for so long that then it starts to change the normal flow and flora of the intestines and the stomach acid, and so it's disheartening to see that. It shouldn't be a
So
long term.
how long should somebody, so like in the case of acid reflux, because this is, it may be more common than we realize. It's not
Mhm.
something that comes in conversation, but it almost seems like everybody kind of understands of, over the counter and such. How long should someone, how long, your understanding that a fair time range for someone to be on acid reflux medication, from
Okay,
what
well,
you've seen?
I'm gonna start with right at the beginning. Why were you prescribed it? And when you are prescribed it, the question that you should be asking is, how long do I need to be on this medication? Because it's right there when it's diagnosed. The diagnosis is what? Is it simply, I have this burning sensation when I go to bed at night and it really hurts. And so the doctor says, oh, okay, I'll give you this medication. Is it that, or is it actually an ulcer that's been diagnosed? And so now you're treating the ulcer. And if you're treating the ulcer, you've got to make sure that you actually treat the ulcer, give your body the time not to build so much acid in the body. And so then it can heal, and then you come off of the medication. So that's the difference between, is it simply just because you're treating a symptom? Or is it because you're actually treating a disease? That's going to determine the length and also why you should be on the medication. I really feel that sometimes, if we have acid reflux, it's really important to understand why. Like, what is the cause of that? And that's all medications and all disease states. What's causing it? Sometimes we know the answer and sometimes we don't. But knowing the answer to that is going to help you on your journey to make sure that you're treated so that you can move away from taking these medications for the rest of your life. And if it's, like I said, if it's a family related issue where it's genetic, you can't necessarily just, exercise it away or eat better and make it go away. But you can put those other things in place to make sure that it's not as severe. So if you're looking at, acid reflux, well, there's certain things that can cause more problems when you are consuming certain medications and certain foods that can irritate that. So you have to look at the whole picture. And that's what we don't do enough of in healthcare for ourselves and as healthcare professionals. Pharmacist is there to give you the medication, but I believe that a doctor, a pharmacist, a nurse, your whole healthcare team has to look at your health, number one. How do we help you become healthier so that you're not reliant on these things? And our attitude towards medication is also, you go to a doctor's office and you don't get a prescription. Sometimes you're like, well, why did I come? Why am I not on a medication? I should have come for a medication. No, you don't need to go to the doctor's office every time and walk out with a prescription. You need to understand what's happening in your body. And that's where we bring in the principles of ACE, right? So A is for advocate, asking the questions in the beginning. Well, what do you think this is? Why do you think I have this? Those things can only be answered by a physician who's looking into all the different tests and looking into your family history. When you talk about communicate, that's your piece. The communicate piece is when you are writing down your signs and symptoms so that you can track sort of a pattern. And women, I'm sorry, but we're terrible in doing this. We need to track our periods. It's part of our health. We should understand the flow. If it changes, why is it changing? If there's bleeding, why is there bleeding that's happening outside of our period? All of these things, it's really important as women that we do as well. And that's just one part of tracking symptoms. But if we wake up and we have a headache, and then it goes away. Okay, well, it was just a headache, but then it comes back and then it comes back again. And then we have back pain and it's ongoing. And so you need to start tracking so you see sort of a pattern. And with that pattern, can you imagine going into the doctor and saying this versus the other? So let's say that I come in and I have a headache and I say, oh, you know what? I've had a headache for 15 days. And my severity has been on a scale of 1 to 10, basically a 3 all the way up to a 10. And that's happened 16 times. Okay, well, that is so clear of a picture versus I'm kind of getting headaches. Yeah, the last month or so, I've been getting some headaches. Imagine now trying to decipher that. So it's much different if you have your signs and symptoms actually recorded and present it. Have the opportunity to present it. A lot of times we get into the doctor's office, we start talking about the weather, or I don't know, something, and then all of a sudden you walk out and you're like, oh my God, I didn't even address what I came here for. So just have your book, have it written down, and just say, I'm here to address my headaches. This is what's happened. This is what's going on. I need help with this. What do you think it is? How do we resolve this? What do you think we need to do? Have your questions already there. Sorry.
And I love that. I think that's an example of growing your voice. Can you give, like, say another couple other examples of what we can do as patients when we're talking to the pharmacist? So when we're going and we're given a prescription and maybe it's medical jargon that we heard and we feel like we're not understanding this language, and then we go to the pharmacist, how can we verbalize our question? Can you give examples of that? Like
Sure.
tools?
I mean, it's really it is quite simple. It's the 5 W's. Why, when, how, where, and what. It really is that simple. And it might seem more complicated than that. But I think of it like, okay, when you are going to pick out a color for your kitchen cabinets and you want to renovate your kitchen, you're going to ask all those questions. Why, what, where, when, and how. Think of it exactly the same. It's a kitchen cabinet. Do you want a square beveled edge? Do you want this? I mean, there's all these kinds of terms. When you go and pick up a prescription and you hand it into the pharmacist, you need to say to the pharmacist what your condition is that your doctor is trying to treat. because we don't know. The prescription does not have written down that we're trying to treat a sinus infection, or it doesn't say that. So we don't know what you're treating. And sometimes a pharmacist will ask, why did you go see the doctor? We're not prying. We're trying to make sure that what the prescription is written for is in fact what the condition it's going to treat will work for. So you need to make sure that you speak to the pharmacist by saying, the first thing you want to say is, here's the prescription the doctor gave me. He's trying to treat my headaches. And so you say, oh, okay. As a pharmacist, I would then say, is this something new for you? Have you had headaches before? No, I haven't. I think it's potentially I'm going through menopause and potentially that could be triggering it. I haven't had this before. We're trying to figure it out. I'm going for a CT scan, or I'm, all these other things. Okay. So then I'll say, do you know anything about this medication? And you're going to say, no, I don't know anything. I just came from the doctor's. He told me to take it twice a day and to see him in a week or 10 days or something like that. Then I'll have a conversation with you and explain to you, okay, this is what the medication is. This is what it does. These are the side effects. And then you're going to say, and this is the important piece of being clear and concise and honest. You're then going to say, okay, well, I take Tylenol 3 times a day. I take Advil 2 times a day. I've been using this herbal product. I've been doing this. I read that I should do this. I want to do this. Tell us what else is going on. And also, oh, by the way, you didn't fill this prescription, but I take this. So it's really important that you provide all the information and you get those 5 W's answered.
This is very powerful, and for all of us, myself included, to learn. We're going to take a commercial break. We've got more coming. Stay right there. Don't go anywhere. We will be right back after this. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Hi, I'm Adriana, and welcome back to Fit Bites. Today, let's talk about eye health and easy ways to protect your vision as you age. Our eyes go through a lot every day, so keeping them healthy is key for long-term wellness. Now, first, focus on nutrition. So foods rich in vitamins A, C, and E, like carrots, leafy greens, and citrus fruits, support eye health and help prevent conditions like cataracts and macular degeneration. Omega-3s found in fish also help with dry eyes. When outdoors, wear sunglasses with 100% UV protection to shield your eyes from harmful sun exposure, which can damage your vision over time. If you spend a lot of time in front of screens, try the 20-20-20 rule. Every 20 minutes, take a 20-second break to look at something 20 feet away. Now, this reduces eye strain and keeps your vision comfortable. And remember, regular eye exams are essential, even if you don't wear glasses. They help catch issues early and keep your prescription up to date. Protecting your eyes now keeps them healthy for the future. Stay proactive and care for your vision. Stay tuned for more Fit Bites with Adriana.
Welcome back to The Health Revolution. Today we're talking about navigating healthcare chaos and the tools and resources we can do to do so that we are set up for success. Our guest today, Lidia Molinara, she is a pharmacist. She's also a patient safety officer, TEDx speaker, and a podcaster. Speaking of, I do want to hold space and talk about your show. So can you tell us a little bit about when you started your podcast and the goal, your mission for it, and the different characteristics that we can come to expect of your show?
Well, I really wanted to bring the principles of ACE to light. And I just started the podcast, and I've got about 20 recorded, and they're just going to be slowly released once a week here in the new year. And basically what I'm trying to do is bring patients as well as healthcare professionals onto the show to have them speak about when things went badly for them or how they navigated the system and the frustrations they went through, their experiences, so that others in the community can learn from that. And also some of the success stories, some of the things that did go well for some patients and some consumers in healthcare spaces, as well as physicians and other healthcare providers like nurses, and what they see and what, in fact, like the whole circle of care looks like in different aspects, so that the people who are listening to the podcast really can take home these tidbits of information to then actually put into their day-to-day practice when they're accessing or going to seek healthcare professionals.
So has it been released yet? So you've just released your
Yeah.
podcast? Yes.
Yeah, we've
Okay.
got 4 episodes up on the website right now. You can find it on Spotify, on Apple Podcasts. So we've started, and it's been really well received, which I'm grateful for. I think it's really something where we don't hear enough about how to do these things, and I think that's why there's so much attention to it. When I did my TEDx talk, I sort of was feeling like everybody knows this, and so afterwards, I had so many people come up to me just saying, this just validates that I do and I should speak on my own behalf. And I always kind of felt like I shouldn't, and that I felt like I should be silenced. And I was like, no. And they're like, absolutely. You've given me the empowerment to actually advocate for my health and be an active participant. I understand the importance of that now. And that's ultimately my goal, is to help people navigate it safely.
Let's talk about your TEDx talk that you had. Share a little bit about it, of course, where we can find it, and because this was a very poignant talk that you gave. And can you add the backstory behind that?
Well, I basically really wanted to let people understand through stories and different people that I have met, the importance of ACE. And I do go through the 3 principles of ACE. I explain sort of how I even became a pharmacist and what happened in my own journey, in my own advocating for my daughter, and subsequently for my father and my parents, as well as my own children. And so I kind of brought that perspective as a patient, and then also wrapped it around as a healthcare professional, the importance of what we do in making sure that you feel seen and safe. And I think it was really important that, and I was so grateful to do it on a TEDx stage, it was really important that people understand the importance of this. And I think through my statistics that I provide, it was a real eye opener. I don't think a lot of people understand what the healthcare system chaos, in the sense, is all about today, and that they need to protect themselves. And I don't say that to, foster mistrust. I say that so that there's a partnership in health, and looking at it that way versus I'm just going to do and listen to everything that I've been told. Like I said, we have so many tools. We have the internet. We have the ability to speak to other patients. We have the ability to be in support groups so that we can actually learn from their experiences. And I think that's ultimately the community that I'm trying to create, is to be able to do that. And it's on YouTube. It's like the 3 key principles of medication safety. And then if you just look up my name, it'll come up. And there's a lot of really great comments, and I'm really happy about it. It's motivated me to keep spreading the message.
And if you were to think about, aside from the patients and clients growing their voices and advocating for themselves, what is one area that you wish that would be a little bit different in all that you are proactively a part of? What's one area that you wish that if you could change, what's one area that you could change besides patient advocacy?
I think as a healthcare professional, I would love to change the system of making things making things more about prevention than they are about ailment treating. And I think that's a whole industry wide, our food industry, our, structure of how medications are prescribed, our health information as far as what's on the internet. It's really important to understand the overall entire scope of healthcare has evolved into being something where we're treating ailments versus preventing. And I think that's really key. As a patient safety officer, I really want to try and make healthcare professionals understand that we have a voice, that we should also, as healthcare professionals, voicing our concerns when work environments aren't providing us the safest aspects so that we can do our job properly, so that we can have patients be seen and heard the way that we feel we need to. I think we need to, as healthcare professionals, also voice that. So both, I think patients and healthcare professionals both need to advocate for a system that allows us to do our best work.
And this is something definitely to remember. We're going to take a commercial break. Stay right there. Don't go anywhere. We will be right back after this. Welcome back to the Health Revolution. And in quality time with our guest today, Lidia Molinara. She is a pharmacist, a patient safety officer. She's a TEDx speaker as well, and a podcaster. She has her own Take Care with Meds podcast. And Lidia, where can we find you in the virtual space?
Well, my website is probably the best place. I welcome people who have had sort of different situations happen in healthcare to reach out to me by email. I'd love to be able to have them come onto the podcast. I'm just starting all my socials. So at Lidia Molinara for Instagram, at Lidia the RX on my TikTok channel as well. That's just been started. So I'm available, LinkedIn, Lidia Molinara as well. So that's where I'm all at. I'm all over them now.
Well, it's good to have a social media presence, and obviously in the space that you're holding, there is great value that we've been talking about. And where can we find you as we're wrapping up 2024, going into 2025? What do you have coming up?
Actually, one of the things that keep coming up is, well, you talk about writing everything down, and we don't necessarily know where we should write all of these things down. So I'm creating a medical journal that has the questions that you want to ask each healthcare professional at each point in the sense of your healthcare journey, and also how to track things and how to have a family history tracking and insurance tracking, allergy tracking. So I'm kind of putting that together where it's interactive in the sense that you get to write down your answers, and there's a space for that too. So making it a little bit more user friendly and making sure that you can then have everything recorded in that journal.
And will we find you in the speaking space? Continue, obviously, being a TEDx speaker. Are you continuing to lend your voice to different groups and different areas? What does that look like?
Yeah, so fortunately, I have been asked to be on several different stages and coming up in 2025, some mom groups, as well as I did a thought leader presentation that's actually going to come out in the next month or so. And it's really about behind the scenes of healthcare and what you need to understand. So that one's an exciting topic that was recorded that will come out as well. So really just everything will be on my website, and there's a lot of information that'll be there.
This has been very enlightening and very empowering because of course, this is not something we talk about, but it affects us all as we are in fact managing our care. Lidia Molinara, thank you so much for spending time with us today.
Well, I really appreciate it. Again, genuinely grateful that I had the ability to do this with you today. I just really hope that it helps people really stay safe in the healthcare system.
I believe so. Definitely believe so. And for all our viewers, of course, you can find us on the web. Our website is thehealthrevolutiontv.com. There you can subscribe to our newsletter. You can also email us with any show episode ideas you'd love for us to cover. In the corner of your screen, you will find our QR code if that's easier for you to grab. And then, of course, you can always find us on the Achieve TV channel on E360 TV every Tuesday and Thursday, 10 a.m. Pacific, 1 p.m. Eastern Standard Time. That is all the time that we have for today. Until next time, take care of yourselves. We will see you soon.